Hello from Johnny, Catherine, and Lillian. Our project is Interdependent Caring, and we are going to take you through our design process of envisioning health autonomy retrieves through building the interdependent platform of local residences in the West Oakland neighborhood. This project presents a new model of care for seniors, their families, and caregivers in Hoover-Foster, Oakland, California. Proposed a community of interdependent regarding to health equity issue, and focused on 3 sample households in 2 sites. Grounded in community-based research on residents, site, and aging in place as well as ADA guidelines, our design intervention focuses on one of the most prevalent issues in the neighborhood, health inequity. By proposing a self-governed community space, senior housing, and a mobile health clinic, studying spatial planning and details such as the impact of material and lighting on the elderly population, we hope to confront convenient care for vulnerable population with chronic diseases. Using interior design redress structural injustice, our project promotes a healthy lifestyle and social cohesion among community members. According to the San Pablo Area Revitalization Collaborative Neighborhood Snapshot, high blood pressure is one of the top reasons for visits to emergency rooms. However, visiting expensive emergency room and hospital services is not an ideal solution to chronic disease. They suggest improving health by connecting to neighborhood clinics, healthy foods, exercise, and health education. There are large hospitals nearby, but the long-term treatment clinics are all located at least 11 miles away. We looked at how environmental injustice can indirectly contribute to the chronic disease rate in the Hoover-Foster neighborhood. Here is a figure ground diagram demonstrating our prototypical design concept, which establishes a framework for larger-scale implementation. The highlighted areas are 2 prototype sites we chose to design, and the gray areas are potential expansion sites. We collected information on the site's neighborhood public facilities that may contribute to the health conditions of residents. One important thing to note is that few public outdoor spaces with greenery are located in this area. It was the information that sparked safety research reflected in 2017. We map out the existing health service and health resources that reflect the limited small health clinics for daily health screening, and also inspire us to create a system that helps to create equity in health service. In a gentrified area like West Oakland, healthy food resources and regular clinic visits are expensive when most people spend their income on housing. In addition, having physical accessibility on site does not mean they are accessible. When we think about the accessibility of the sites, easily accessible public transportation can help provide convenient care for the residents and allow them to interact with the outside communities in the context of the diverse culture and society. A notable environmental factor that may bring health risks is the highway close to our chosen site. There will be air pollution, noise hazards that all contribute to the increased risk of heart disease. We also did a racial demographics that show the majority of the races in each block of Oakland. We learned the diversity of races in this area and the importance of creating equity for people with different backgrounds and protecting the marginalized population. According to the article, America isn't taking care of caregivers by Vox. There is an unbearable burden on the domestic caregiver from colored minority ethnic groups from lower income households. We identified a cultural norm of not transferring the care to professionals from our research. As members of the East Asian community, we feel connections with the difficulty. Before getting into our design interventions, we would like to demonstrate our neighborhood framework and design strategy using diagrams. We've created 3 households for the caregiver family, multi-generational family, and Asian immigrant family. The color-coded time activity diagrams picture how our 3 households interact and overlap in a typical weekday. Morning is the busiest time inside each house as everyone gets up and leaves. Seniors take a walk in the morning when the sun is warm and bright. Most social interactions occur at the community space at our site A at 867. Then residents enjoy their family time and privacy at night. We'll be introducing you to our sites and residents in detail in the later slides. The neighborhood diagram here further illustrates the connections and interactions among the 3 households and community daily as one of the most significant elements in our proposal is kinship. Every effort of health improvement and caring will not be executed without the help of local participants. We propose interior design as a base for this relationship to develop because we support solidarity as the most powerful weapon to resist social suppression, gentrification, and exclusions. Our first site is located at 867 35th Street in Hoover-Foster area. It is a single-family house with a conventional, confined, and divided layout. There are multiple non-senior friendly elements in the existing, such as narrow doorways and complex partitions, that prevent interactions. This site is located close to the highway. Therefore, minimizing the impact of pollution would be a primary consideration. A family of 4 will be the users of this house. They are 2 teenagers parented by 2 women who work as a web designer and professional caregiver separately. Most of their work will take place in the building. Maria runs a community center on the ground floor and Olivia works remotely. Program-wise, the house is divided into 2 spaces according to their functionality. The ground floor community center opens to the public, and the second floor is dedicated to the family as a private zone. Different entrances on the ground floor separate the private and public circulations in the house, and acoustic panels are applied for noise prevention. Both outdoor and indoor space play essential roles in the design. The adjacent sidewalk, front yard, and backyard are utilized to serve the program. Color zoning is integrated for easy visualization to senior and young users. We use colors on walls to imply different territories and functionalities of spaces. When the family comes home, they will enter the house through the side entrance. A foyer with spiral stairs is the first space they encounter. The stairs have the affordability of a chairlift to accommodate users with walking difficulties. Climbing up the stairs, a living space with a sofa and lounge chair shows up in their sight. The color palette of the residential spaces is coherent and calm to create a homely feeling. We value the sense of boundaries in our project. The children have private bedrooms despite their size. When the guest arrives, they will join through the main entrance with a double door. The first thing people will encounter is the event space that serves many activity possibilities. It was established with regard to the need for health lectures that the Spark report suggested. An open layout affords conversion easily by arranging stools and chairs. According to the honorable guest speaker, Annie Ledbury's suggestion, food is an irreplaceable element for community activities. A shared kitchen and dining area function as the bond of the people of the space. More significantly, a community space that serves healthy food choices may help members who struggle with food desert circumstances. Standing up assisting chair was integrated into the event and community dining space. Featuring handles for different gestures, a slight angle at the bottom, and a taller seat height, this custom chair is designed to help people with mobility difficulty get up and down easier. The next space is the indoor garden. It is a working zone for processing produce, growing indoor species and lecturing. We received feedback that some community members are undergoing information gap. We propose this space to be used as a platform for communicating knowledge and experience about food resources. The outdoor garden plays multiple roles in demonstrating environmental justice strategies. It is a fundamentally green space for users to inhabit and interact in response to the lack of public greenery issues in the neighborhood. It demonstrates the holistic nature of our program by arranging the wheelchair-accessible table, waist-high planters, and reclaimed wood fences for environmental consideration. The bushes and trees are a natural buffing zone that protects the space from noise and air pollution from the highways. It is a productive growing space where community members can grow and take home their fresh groceries without the expensive cost. A diagram of local edible species shows the potentiality of this program. The planting space acts as a demonstration zone for lecturing on propagating edible plants in the domestic setting. Also, the act of cultivating and propagating leads members to participate in light exercises indirectly. They are all responding to the Spark report suggestions. The outdoor garden provided a welcoming space to socialize. A table that connects the indoor and outdoor gardens makes conversations possible for people from different areas when they sit at the same table. The table is one of the most effective tools for promoting communication. How does our design promote social cohesion from the larger concept down to furniture and lighting details? Well, a special program that we have is the outdoor space at 867 35th Street. It is a place for community building. Strategies to improve community and health-related issues include a mini farm where residents grow their own organic food, passive design like senior-friendly furniture that encourages communication, and translucent fences made of reclaimed materials to artistically promote sustainability and to blur the boundaries between neighbors. This translucency can be controlled by the household simply by changing the amount of pebbles in between the mesh container. With only a 5-minute walk away, our second site is a 2-level apartment building at 990 34th Street with a view of San Pablo Avenue. We learned from existing plans and photos that partitions divide the space into small rooms and narrow hallways that are not easy to circulate or senior-friendly, especially the bathroom. We would like to propose an open floor plan with privacy instead. Our second household is a multi-generational family with 4 residents living in the first floor of 990 34th Street. Rebecca and Jason are the elderly couples in the family, and Jason has high blood pressure which gets regular health screening from Maria in the caregiver household. Jason loves to play chess with the neighborhood and watch movies with Rebecca. Rebecca walks with difficulty and sometimes requires a wheelchair. She loves to read and sew. David is the son of Rebecca and Jason. He works as a teacher and enjoys cooking. He also takes care of his parents and daughter, Amy. Amy is an 8-year-old girl in the family. She loves to cook with her father. While designing a multi-generational household, we believe it's essential to create a conversation between the different generations through spatial planning. The floor plan on the left demonstrates several ample and flexible shared spaces, including the living room, home theater, open kitchen, and dining room. We designed and developed the lighting and materials palette that helps to create a safe, comfortable, and welcoming environment. The space is mainly illuminated with recessed downlight, and a linear pendant light is utilized in the open dining room that invites people to gather around to share the space and interacts with each other. The materials palette on the right shows that we focus on choosing materials that are warm, modern, and welcoming to people of different generations that help with aging in place. Some aging-in-place adaptations we applied in this household include the ADA-compliant bathrooms that are accessible to elderly family members, Rebecca and Jason, or elderly visitors. The space is also designed to be friendly to wheelchair users. There is a wheelchair lift in the front of the apartment, and the interior is designed to be barrier-free to circulate. One of the important public programs in the household is the home theater. A movable sliding door system is designed that allows the space to be fully opened and be used as part of the living room space. It can also be fully closed and become a more private and separated space, and it won't affect the use of the other spaces. The shared space helps to bring the family together and break the boundaries of ages. We also believe it's important to establish a balance between shared and private space. To ensure the privacy of family members of mixed ages, we designed customized individual bedroom space for each residence. And last but not least, our third household will be a first-generation immigrant couple living in a 2-bedroom 2-bathroom unit on the second floor of 990 34th Street. They are very active and extroverted. May loves outdoor activities like hiking and yoga, while Bao enjoys traveling and documenting people and places through photography. Bao has chronic heart issues that require regular monitoring and care from May and his caregiver. Their granddaughter Mia, who is 7, sometimes comes and visits. The rendered floor plan on the left shows architectural materials of the apartment. Featuring a spacious deck equipped with a stairlift, an inmate creative corner for Bao's hobby, an open living space, an ADA bathroom, and a package shelf upon entry, this apartment provides a pleasant space for family living. We've considered how material and lighting can help with aging in place. As indicated in the lighting plan, there'll be 3 layers of light working together to create a soft, comfortable, and calm residential interior. The space is mainly lit up using ambient downlights and softened with concealed strip lights. Pedants and lamps act as functional and decorative elements. We've consulted with the aging-in-place guidelines. One important consideration when designing for seniors is to prevent glare, especially in wet areas like the bathroom, and provide sufficient lighting in the exterior deck at night. This is achieved by adding subtle strip lights that illuminate the space from both front and top directions and incorporating under railing light around the deck perimeter. Comfort, safety, and affordability are our priorities. In the material palette on the right, we've specifically selected resilient and non-slippery materials and gained inspiration from the use of wood in Asian domestics with a mix of modern American design. We're using flat woven carpet for it is firmer than, for example, frieze carpet, therefore less tripping hazard. For Bao's heart disease, there'll be an alert system throughout the house, especially in the bathroom, where he can press the help button to notify others in case of an emergency. We recognize the diverse demographics in West Oakland and wanted to celebrate cultural heritage. The bottom collage depicts a scene where Bao teaches her granddaughter Chinese characters on the floor, since gathering around a low table is an integral part of family bonding in a lot of Asian cultures. The interior elevation at the top gives a closer look at the kitchen that has easy-to-use cabinet handles, awning windows, and under-cabinet light. This kitchen also has a wide clearance between the counter and island, as well as stools, because we think that cooking and food brings people together and that the kitchen should be not only for the person who cooks, it is also a place for every family member and friends to participate and interact. This is a view showing the granddaughter Mia playing with her friends after school. Inspired by architect Jermaine Brin's project, A Spectrum of Blackness, where he interviewed African American, Latino, and Caribbean people about their spatial experience growing up, we've learned the cultural significance of porch and how children may feel constrained in shared spaces with adults. Meanwhile, to prevent generic design and practice empathetic design instead, we've created this children's bedroom that is distinct from the rest of the apartment. It is a private place where children have the freedom to wander, similar to a porch. The deck at 990 can be used as a semi-public space for family, friends, and neighbors. This exterior perspective renders a casual social gathering at the deck. We applied a creative design exercise from the program Primer article and turned the experience of transporting people using a stair lift into a journey upward. The exhibition boards displaying local photography works or other community-related contents continue from the beginning of the stair all the way to the deck to create a sense of narration that occupy the stair lift user's eyes and prevent the boring wait time going up. While researching on local context in healthcare, we found mobile health clinics to be a highly effective implementation for chronic disease management, especially in low-income and vulnerable communities. It helps reduce healthcare costs by avoiding emergency department visits, reducing hospital readmission rate, and increasing life quality. According to big data, more than half of the clinic's clients are women and racial ethnic minorities. So, we designed this special program as a mobile interior. It is a primary care and vaccination point that offers daily monitoring and screening for chronic diseases, vaccination and testing, and basic sampling. Knowing that a lot of local caregivers don't drive, our van can also help them commute around the area. With the capacity for 10 people, the clinic is equipped with a retractable wheelchair lift, medical freezer, built-in cabinetry, monitor, diagnostic station, and an exam table. We've incorporated an artificial skylight, resilient and durable rubber flooring, as well as blue upholstery to create a calm and clean space for all. The mobile medic van will be parked in the yard of 990 34th Street. It functions as an extension of the clinic office that can be driven around to visit people in the neighborhood who needs help. It will also be operating in front of the community center at 867 35th Street, which works as a temporary supplement healthcare program. Finally, we would like to end our presentation using this exterior view that renders our vision for social cohesion. Keeping in mind the residents' feedback we received from community engagement sessions this semester, the mobile health clinic will provide service and contact information on the exterior of the van, making it more accessible for seniors who are not familiar with online platforms. As a neighborhood asset, it can also help promote community events and stories. Apart from interior interventions, a holistic, healthy neighborhood will also have a range of inclusive devices, including ramps on the sidewalk, streetlights, shared benches with armrests, etc. We hope our project proposals could be practical in helping with community health equity. However, it is not a social intervention project due to the academic field constraint. Thank you for listening, and please let us know what questions you have.